how to protect yourself from liver cancer. That's what we're going to discuss in this session today. Thank you for joining us. And my name is Dr. Vinay Samuel Gaikwad. I'm the Associate Director and Head of Surgical Oncology at Pancreas Hospital in Gurgaon. So these talks are for the general person who's interested in learning something about cancers, and specifically GI cancers. Today we're going to be talking about liver cancer. So you'll come to know what the liver is, what liver cancer is, and what we can do to protect ourselves from developing this quite dangerous cancer. So diving into the topic, the liver is the largest internal organ in our body. So it lies below the ribs on the right side, inside the abdomen. It has two lobes, the left and right, and when we're surgeons we discuss it in 8 segments. So what does it do? The liver breaks down and stores nutrients. So it does something called metabolism. In addition, it also makes clotting factors. So these are what prevent us from bleeding. So that's why you might notice if a liver fails, there could be bleeding from any site in our body. The liver also delivers bile, which it produces to the intestines to absorb nutrients. Bile is an important juice which is produced by the liver, and it also breaks down toxic substances like alcohol and other drugs and disposes it from our body. It's like a filter. So now that we understand what the liver is, let's try to understand what liver cancer is. So when we're talking about liver cancer, we have to distinguish between liver cancer that originates or starts in the liver and liver cancer that starts in some other organ and then later spreads into the liver. So when it starts in the liver, we call it primary liver cancer. The most common being hepatocellular carcinoma, which is what we'll be talking about today. When it spreads from other organs, it's called metastatic disease, and it could be benign tumors. So any tumor in the liver does not have to be cancer. So there could be hemangiomas, which are nothing but a sac of blood. Sometimes these hemangiomas get so big that we have to do something about it, but most of the time we can just leave them alone. And there are other benign tumors as well. But coming to what we call HCC or hepatocellular carcinoma, so we'll be discussing that today, and what are the risk factors for developing this. Now, gender, the male gender is more predisposed to this cancer. Certain races are more disposed to this cancer, and most importantly, chronic viral hepatitis, that is hepatitis B or hepatitis C. So these are transmitted to us through the blood. So if we have a history of blood transfusion, in the past it was very rampant, and now as time is going by, this disease has come under control in many countries, but still it's quite a common disease, hepatitis B and C. So having that is a very, very important risk factor to note. Liver cirrhosis. Now that means when the liver is permanently damaged. So you don't have to be an alcoholic to develop cirrhosis. There could be other conditions like non-alcoholic steatohepatitis, or even primary biliary cirrhosis. So these are things, but the basic pattern is a hepatitis to cirrhosis to cancer. So it's not necessary that all hepatitis patients will develop cirrhosis, and it's not mandatory that all cirrhotic patients will ultimately develop cancer, but that is the general pattern of development. So what are the risk factors that we know about when it comes to liver cancer? First and foremost is heavy alcohol use. That's something we can really avoid, and because alcohol damages the liver, causes hepatitis, cirrhosis, and ultimately can lead to cancer. Tobacco use, as in most cancers, is lethal. Obesity, diabetes, many rare diseases in our body, which we won't get into. There's something called aflatoxins. Now that is basically, it's a toxin produced by fungus, which can be in many grains like corn, even rice, wheat. So it's something that we have to be aware about. That can, after we consume it, then cause liver cancer. Certain chemicals can cause it, and even anabolic steroids. Many athletes and bodybuilders do use injections and tablets with steroids, and these have been known to cause liver cancer. So many liver cancers can be prevented by reducing risk factors. So we have to avoid hepatitis B and C. How can we avoid it? By getting blood transfusions only in authorized places, by making sure even a simple thing like a shave, when we get it outside, we have to make sure that the blade is a disposable new blade, and so on. There are many things that we can do. And if we are detected to have hepatitis B or C, we should seek treatment by a hepatologist or a gastroenterologist or a physician, who then checks everything including the viral load and then starts treatment. And by keeping the hepatitis B and C under check, that will really decrease the risk of developing liver cancer in the long run. We can also limit alcohol and tobacco use, get to and stay at a healthy weight, limit our exposure to chemicals which can be harmful, and we can treat diseases, as mentioned before, which can in time lead to liver cancer. So the Indian Council of Medical Research has also come up with guidelines as to how we can treat and prevent and even perform surveillance on patients. I'm happy to be part of that subcommittee that comes up with these guidelines. Can liver cancer be found early? We can screen high-risk individuals. Now by high-risk we mean especially patients who are diagnosed with hepatitis B and C. We recommend that all patients who have been detected get an ultrasound at least every 6 months, and an AFP, which is a tumor marker called alpha-fetoprotein, that will really help detect small nodules like dysplastic nodules, which can mimic cirrhotic nodules. So we can detect it early and maybe treat it before it gets out of hand. Signs and symptoms like weight loss of appetite, nausea, vomiting, maybe you can feel a mass in your right upper abdomen, which might be the enlarged liver. On the left side it would be an enlarged spleen, abdominal pain, jaundice, which is yellowing of the eyes, maybe itching, which is inexplicable, and then with jaundice that could be something that's a sign of liver cancer. Coming to treatment, when cancer in the liver is detected, we try to see if we can remove that cancer with surgery, maybe removing up to 70 or even 80% of the liver is okay, because the liver can sustain with just 20 or 30% function, volume I mean, the function is maintained. And also the liver is an organ that can regenerate, so up to 75% of the liver can grow back if it fits into a certain criteria in terms of the size and the number and so on. Even if the patient is cirrhotic, that means if the whole liver is as it is destroyed, then a transplant is a good option, a liver transplant, either with a living donor, if somebody you're related to can donate the part, or diseased donor, which is a cadaveric program that you have to go to specialized centers for that. Other treatment options like targeted therapy, which are tablets which kind of help to keep the disease under control. There's something called TACE and TARE, which is trans-arterial chemoembolization and trans-arterial radioembolization, in which the hepatic artery is kind of cannulated, like how you do in a angioplasty for the heart, and either chemotherapy or radiation particles are introduced into the artery to go and block the blood supply, as well as try to shrink the tumor in the liver. Nowadays even radiation such as SBRT is being increasingly used to control liver cancer, and then we have immunotherapy, which is a very new development which can help certain patients with liver cancer. So with that, we have learned a little bit about what liver cancer is about, what the liver does, how we can decrease risk of developing liver cancer, and a little bit about the signs and symptoms and the treatment. So thank you for joining in on this session, and please subscribe if you find this information helpful, because there will be more videos on similar topics in the future. Thank you.